UNAIDS Regional Support Team cover the 25 countries in West and Central Africa, and then we basically provide technical support, guidance to the UNAIDS country offices and then other partners. When you look at one of the challenges that we are faced with in the AIDS response, as I indicated in my presentation, it's about the external dependency. I mean, I would say, especially when it comes to implementing AIDS program and then AIDS activity, I would say roughly about 60 to 80% of the resources, that are used to implement AIDS program and activities, in sub-Saharan Africa are from external sources. So it means that, our government and then our private sector at the country level definitely need to do more. So it means what? It means if today we don't have Global Fund, we don't have PEPFAR, unfortunately, so some of the activities that we're currently carrying out will come to a standstill. People who are having antiretroviral drugs will not be able to continue to have access to those antiretroviral drug programs geared at eliminating mother-to-child transmission, condom promotion, and so on and so forth. So it is important that as UNAIDS, as countries, as partners, we really find ways and means of how we can reduce that external dependency, which is not viable if ultimately we want to sustain our response, and then eliminating later on HIV and AIDS. On one hand side, there's a challenge that we really need additional financial resources. There's a funding gap of what we really need, to scale up the response, because the needs are much more bigger than what is available. But in the other hand, you also face a situation, especially not only in sub-Saharan Africa, but more specifically in West and Central Africa, where we recently conduct situational analysis, just looking at the grant performance of the Global Fund. The Global Fund being the #1 funding agent when it comes to providing AIDS resources. Where resources are available, but unfortunately, so the implementation is not following. So the money is not working, as we rightly say. Some of the challenges range from what? From governance. There are issues about governance, not being able to follow the rules and regulations, agreed upon by the Global Fund. There are issues about financial management, just that the PRs and then the sub-recipient who get the money, to really deliver on a set of activities and deliverables, they just don't know how to manage those resources. The third one, which also it's important, it's a major obstacle in making the money work, has to do with stock out, stock outs of antiretroviral drugs and other HIV commodities. So there's a need also here to strengthen the capacities in such a way that we can promptly manage the procurement and then the supply management chain. Last but not least, it's also issues about the quality of the data, that we are having. Can we, if country A says, as we speak, about 10,000 or 20,000 people are on treatment, how sure that those data are accurate and reliable? What we have now, it's already a technical support plan in those 6 countries. And then at UNAIDS, we're also providing the support to the other countries in such a way that they can have a technical support plan that will outline what they need. So what we're doing is that we're advocating, in such a way that countries can put more resources, to fund the technical support plans. What we are also doing is that other partners can rally around it. What we are also doing is to see how we can strengthen the capacities, at the national level, working with institutional, at the regional, and also at the national level where as possible. Last but not least, also seeing how they can continue to use the technical support facilities. UNAIDS has established what they call technical support facilities. There's one in West and Central Africa, which is based in Ouagadougou, but there's also another one which is based in Johannesburg. Is it possible? And negotiations are really far advanced in ensuring that when this project comes to an end, they can continue to benefit from and then source technical support. What is really important in the long run is to measure the commitment, to really make sure the progress that the country is doing. You could also look at the national institutions, who are really providing the necessary skills, training, integration in the various curriculum, in such a way that comes 2015, 2020, or 2050, who knows, so HIV and AIDS could be something of the past.